I'm often asked why, of all things, I became a bariatric surgeon. I became a bariatric surgeon by mistake, in a certain sense. I was a three-sport athlete when I was in high school. I never had a problem with obesity in my life. None of my family members ever had significant obesity-related issues. I happened to come along at a time in my training surgically where laparoscopy became in vogue. And I learned from the very beginning of my training, through my training, laparoscopy at a level that most people couldn't do because I just happened to come along at the right time. The instrumentation that we currently use in the operating room did not exist when I started to do laparoscopic surgery. And as I became more and more familiar with it, we started to do appendix operations and gallbladder operations and some rudimentary stomach operations, but it was clear that we probably could do most general surgery procedures if we had the right equipment and people had the right technical skills. For one reason or another, I was someone who had the right technical skills. And at a certain point, there was a suggestion that bariatric surgery was beginning to be undertaken laparoscopically and that it was particularly difficult. This was a challenge that was put out to myself and another surgeon that I had been working with to decide whether we could undertake the procedure safely or not. We investigated it and eventually found that we thought that we could perform the procedure and indeed did start to begin the procedure. And an interesting thing happened along the way. We found that the patients after surgery became better and better and better, and each subsequent visit in the office became a celebration. Rather than the type of patients that we had been taking care of previously, which would include cancer patients who may be sicker and sicker and may be more and more depressed with their subsequent follow-up visits, I found that bariatric patients became happier and happier. As their diabetes went away, the incredulous looks on their face and the family responses to it were dramatic. As the patient's weight melted away and they actually began to be able to do things that they haven't been able to do for 10 to 15 years, it became something that I realized is a very, very important thing. As I saw the medications melt away and as I saw the quality of life improve and the dramatic effects not only on the patient but on the family, on the children, on the adult parents, that is what hooked me on bariatric surgery. And one thing in particular, one of my patient's mothers began to cry one day, and I asked her why exactly she was crying. She obviously was happy that her son had done surgery and had done well. And she tearfully stated that it was the first time that she was ever able to hug her son and have her two hands meet behind her son's back. That was the day when I knew I was in the right place.